So one of the things I wanted to talk about is how important sleep is just in general. And so, I really like this slide that sleep is one of the 3 pillars of physical health. So it's, it's as important as eating. It's as important as exercising and being, in movement. And so, it is really something that we need to focus on. It's one of the reasons I have a job. And so, one of the things that sleep is really useful for is it helps the brain and body kind of rest and recharge. A lot of things happen during sleep. The heart rate decreases, our blood pressure decreases, and this allows the heart to kind of rest and repair itself. One of the things we'll talk about is whenever we have a lot of awakenings at night, that actually interrupts the heart's ability to kind of do the things that it needs to do so that, it can have, heart issues down the line. There's 4 stages of sleep that which are all important, which allow the neurons to rest and repair. I always try to explain it like it's like the neurons are kind of repairing their potholes that they make over the course of the day while we're sleeping. And so it's really important to give them time to do that. And then metabolism decreases, which is really important for the GI tract to kind of rest and rejuvenate and kind of build itself back up to get ready for the next day. The American Academy of Sleep Medicine, which is kind of my governing body, recommends 7 to 8 hours of sleep per night. The really good data looks at kind of less than 6 hours. And so there's a lot of studies that have been published that say less than 6 hours, again, can cause heart stress. It can affect memory, mood, decreased attention and concentration, and certainly can affect things like blood sugars and that kind of thing. And so again, the first thing we're going to talk about is sleep apnea. And so this is just kind of an overview. Hopefully you guys can see this slide. It's a condition where we basically stop breathing periodically during the night. And so it's not just one episode, but it's several episodes. And so basically what happens is the airway collapses in the back of the throat. So the picture on the left is where it's open, and then the picture on the right is where it's, collapsed. And so symptoms usually include things like heroic snoring. I always tell people, if your partner tells you you're, snoring the paint off the walls, that's probably something that you need to come see me for. It can include irritability, forgetfulness, falling asleep easily. And then one of the really common symptoms we see is headaches, especially in the morning. And so again, what we're doing when we diagnose this is we look at a frequency on the sleep study. And so, if it's greater than 5, that's positive, but 5 to 15 is mild, 15 to 30 is moderate, anything above 30 is severe. And generally, we really look at trying to treat people above 15, although I always tell my sickle cell patients if there's a lot of deoxygenations, which can be a problem because of the sickling, then usually we like to treat that as well, even if it's mild. And so just to talk a little bit more about sleep apnea, so this is general population. So I wanted to kind of present a slide about general population, and then we'll talk about sickle cell. So in the general population, it's 2 to 4%. Again, the Wisconsin sleep cohort study kind of spawned my field. So it showed that men, people in older age and people with higher BMI tended to have more sleep apnea. The relationship for sleep disorder breathing is greater in men than women. And again, it goes up as the age goes up. The prevalence of sleep apnea in sickle cell patients is a little higher. So it's 17 to 44%. And actually the data for children is even higher at as high as 69%. So again, there's some pretty decent studies that are looking at this in the sickle cell population. And there does seem to be an increased risk in the sickle cell population. And so I just wanted to go over this. So there's like some classic symptoms for sleep apnea, but interestingly, they don't apply usually to sickle cell patients. And so, the classic symptoms include things like snoring, being tired, again, people noticing that you stop breathing at night, high blood pressure and BMI, again, older age, neck circumference, which is for men would be kind of like how the size of your collar. And then men, again, have it more than women. You can actually go to the next slide. And then sleep apnea in sickle cell patients differs. So a lot of the studies that have looked at the relationship between sickle cell disease and sleep apnea have actually found that they don't tend to have a BMI. So their BMI is actually normal. They actually can be young. they tend to have normal blood pressures. And so, you know, one of the things that really kind of surprised me in doing this talk is that traditional screening tests for OSA often don't identify patients with sickle cell disease who have sleep apnea. They don't have nearly as much sleepiness that we tend to see in the general population. One of the things that is noticeable, again, based on these studies, is that they tend to deoxygenate more, which, you know, makes sense because there's, you know, it's harder to carry the oxygen. But it was a pretty interesting finding that the traditional symptoms that we look for are not usually what we see in sickle cell patients. And so this is just, I just wanted to talk a little bit about sleep apnea and what it does. And so again, it's where the airway collapses and then we don't get oxygen to organs. And so that puts a lot of stress on organs. It can cause increased inflammation. It can affect the heart. It can cause the heart not to function as well. Again, it can cause elevation of blood pressure. It can slow down metabolism. It can affect how we, you know, manage how our body manages our blood sugars. So there's a lot of, you know, again, systemic stress associated with not treating sleep apnea. And so there's a lot of benefit to treating it. So this is one of the studies. And so this is a really interesting study. It's being done in France. They're going to stop recruiting for the study in 2023. But basically, they're actually looking at whether sleep apnea can trigger sickling in patients with sickle cell. So this actually hasn't even been looked at, but certainly seems like something that needs to be looked at. And so they started recruiting in 2018. They're going to stop in 2023. And then hopefully after that, we'll get some information. But I mean, anyways, it looks like a pretty interesting study. It looks like a lot of data that needs to be discovered and kind of elucidated. So that's good. Somebody's doing that. And then just to talk a little bit about the treatment of OSA. So the classic one is positive airway pressure. You know, I tried to show a slide of what it really does. So really what's happening is the air pressure is kind of pushing the tissues apart to get the airway open. Oral appliances are probably the second best treatment, I would say. You know, certainly about 20% of my patients don't like using CPAP. And so usually then we'll talk about oral appliances. It's kind of like wearing a retainer. So it pulls the jaw forward, which opens up the back of the airway. And then surgery is the least, I recommend surgery the least. It tends to have the least effectiveness. So basically the most typical surgery for sleep apnea is they cut out the back of the throat. They cut out your uvula, which is the little piece that hangs down. And then that kind of clears up the back of the airway. But that surgery tends to only have about a 50% effectiveness rate, which is not great. So I tend to try to do something else. This is the newest thing. So I just wanted to put this in here because everybody's talking about it because there's ads for it right now. And so the Inspire is a procedure where it's kind of like a pacemaker. So they put a battery pack in your chest wall. It's a pulse generator. And then they thread an electrode to your hypoglossal nerve, which is the nerve that controls the tongue. And then basically what you do is you use the little remote that I put a picture of in there. You swipe it over the pulse generator. It turns on and it pushes the tongue out of the back of the throat, which opens up the airway. The data honestly looks pretty good. I mean, it seems to be pretty effective. It's much more effective than the surgery that I showed you on the previous slide. There are some side effects associated with it, but apparently most improve within 30 days. But I always tell people it is a surgery. So generally, if you can tolerate PAP therapy or an oral appliance, that's probably better. So insomnia. So this is probably by far, I will tell you that I see a lot of patients from Dr. Iffy's clinic, and probably by far most of them end up having insomnia. They actually have normal sleep studies. And so this is a big topic I really wanted to talk about. We can go to the next slide. So insomnia is very common. I have a saying that I tell my patients that I personally believe everybody in their lives at some point experiences a little bit of insomnia. Insomnia, again, is just difficulty falling asleep and or staying asleep. It affects a third of the population. It can cause all kinds of symptoms, certainly irritability, exhaustion, again, decreased attention and concentration. It can impair our daytime activities. We're too exhausted to do anything. It's got a huge socioeconomic burden, greater than 100 billion annually. Between 10 to 30% of, so these are just some general statistics, again, not sickle cell specific. but between 10 to 30% of adults report suffering from chronic insomnia, and compared to whites, ethnic minorities are almost twice as likely to complain about sleeping too little. And women have a 40% all lifetime risk of insomnia. And so then this was just another graphic kind of showing that insomnia is, really prevalent in kind of more the ethnic minorities and that kind of thing. And then here's the data about insomnia and sickle cell. So 40 to 70% of children and adult patients with sickle cell disease suffer from insomnia. So again, that's higher than the number I quoted with sleep apnea. So it's 17 to 44, 40 to 70 is higher. It tends to, the data that where they kind of cross section, kind of these are other factors. They found that lower education increased the risk, increased disability, inability to work. Those two things are kind of related, but all those things caused a higher insomnia severity. This is the only slide where I found studies that distinguished between types of sickle cell. And so it's sickle cell and beta positive thalassemia have a higher severity than sickle trait and beta negative thalassemia. I'm probably not saying that right, but anyways. Acute pain and depression were individual predictors of increased insomnia severity. And then there's some studies that looked at kind of consequences of insomnia. So decreased sleep time, decreased time in bed, and increased sleep fragmentation, increased pain severity reports in patients with sickle cell, and increased wake after sleep onset, which is basically where you wake up and you have trouble going back to sleep, predicted increased narcotic use in sickle cell patients. So there's a definitive consequence related to not sleeping well and having sickle cell disease. And so I just wanted to go through some of the insomnia types. Everybody kind of starts usually with adjustment insomnia. So they usually develop insomnia secondary to a stressor or something like that. And then it becomes chronic as that adjustment insomnia kind of doesn't go away. And then, there's some types where you can have an idiopathic insomnia from childhood. Sometimes insomnia can manifest as our circadian rhythm disorders can manifest as insomnia. Our circadian rhythm is our body's normal sleep-wake cycle. Everybody's got one. And so sometimes people sleep a little earlier in the night. Sometimes people sleep a little later, which is much more common. But for the later folks, if they go to, need to be up at 8 a.m., and their body's not wants to sleep between 2 and 10, and they're trying to go to bed at 10, right? They've got 4 hours of insomnia, but it's related to their body's normal sleep-wake cycle. Certainly, mood disorders can increase risk for insomnia. I always tell people 5 out of 9 diagnostic criteria for clinical depression are insomnia related. Medications, steroids, some antidepressants, chronic medical conditions, and then underlying sleep disorders certainly can contribute to not sleeping well. So this is a cool slide. This is really interesting. I saw a lot of slides for tips for, or a lot of graphics for tips for healthy sleep, but I thought this one was probably one of the best. And so this really applies to when you're in bed, I would say. So again, trying to avoid heavy foods, trying to stay away from any electronic devices, avoiding alcohol. I always tell people no alcohol within 2 hours of bedtime because your body just doesn't have enough time to process it. Stay away from caffeine within 6 to 8 hours of bedtime, because again, caffeine is a wakefulness promoter, so you generally don't want that right next to your bedtime. No heavy exercise, and then try to eliminate stress, which is, that's all well and good if we could all get rid of our stress. One of the things, and I'll talk a little bit more about this on another slide, but one of the things that I find really important and that really reinforced itself over the pandemic was having a consistent bedtime. And so I think having consistent bedtime is really important to, maintaining again, that body's normal sleep-wake cycle when you want it, and can really help with kind of training your brain when sleep is supposed to occur. Certainly having a comfortable bed, having a routine. I always tell people try to stay in bed. There's an old-timey recommendation that says to get out of bed after 20 minutes if you're not asleep. That was from the 70s. I don't think that's a useful recommendation since the internet exists and started existing and we started having computers in our hands. I just don't think that's a great recommendation anymore. Anyways, just trying to relax, and meditation's good. But anyway, and we can go to the next one.
Sorry, can you see this? This is the three.
Get stuck. Okay, there we go. So these are my 3 highest yield healthy sleep habits. So again, if you can't do anything else, these are the 3 that I think have the most weight in terms of being able to help kind of mitigate some of the difficulty sleeping. Again, maintain consistent bedtime, wake time, even on off days, so even on weekends. You know, I always tell people who are night shift workers who, you know, want to switch back so that they can spend time with their family, you know, come talk to me, because that's tough. And I know that that's, you know, it's hard to have somebody tell you to keep a normal sleep wake cycle when you want to see your family, when you don't have to work. Limit time in bed to 8 hours. So one of the things that I find a lot of people do who have trouble sleeping is they kind of extend how much time they spend in bed to try to increase their sleep time, but that's actually counterintuitive, because then it increases how much wake time you have in bed. And then your brain kind of forgets the bed's for sleep. So it's real important to kind of limit how much time you spend in the bed. And then trying to avoid visually stimulating activity if you can't sleep. So again, if you wake up and you're struggling to go back to sleep, for instance, try to stay away from picking up the phone, turning on the TV, you know, that kind of thing. I think audio is really helpful for people who have trouble sleeping because their mind's racing. If you want to use the TV for audio, I recommend getting a sleep mask so you're not getting any of the light from it. If you want to use a smartphone to say put on a streaming service that you can listen to, just make sure you put it face down so you're not getting the light. You know, one of the other kind of, in my opinion, controversial recommendations is to like turn everything off 2 hours before bedtime. I don't think that's really necessary. I mean, if you've got really severe insomnia, maybe, but I think for most people, as long as you just keep the lights out of the bedroom, I think that's sufficient. And then just some, like, you know, lesser yield but important sleep habits. Avoid napping for more than 1 hour a day and within 6 hours of bedtime, and avoid drinking caffeine, again, within 6 to 8 hours of bedtime. And so there should be a second thing on there. I guess it's not there. The idea is not to use pills. I had a little X on the pill one. I don't know what happened to us. But there's a really big push in the, again, in the sleep world right now to try to avoid using medications, try to reteach people how to sleep, you know, retrain their brains how to sleep, that kind of thing. And usually that's done with cognitive behavioral therapy. I put the pharmacotherapy up there first because that's generally what we all think about, right? When we start having trouble sleeping, we want to go to the medicine cabinet, we want to grab a pill, but that's really not the idea. That's, you know, again, generally we're trying to get away from that these days. And then these are just some CBT resources. So again, this is the brain retraining kind of thing that is being really heavily pushed and is really being encouraged. And so there's a couple of books here, Sleep Through Insomnia and Say Goodnight to Insomnia. The Sleep Through Insomnia book's 170 pages. The Say Goodnight to Insomnia is like 450. So it depends on how much you want to read. Sleepio is a good app. It has a little coach that'll come out and kind of talk to you. This is one of the few apps where you kind of would get on it, like in the middle of the night if you couldn't sleep, and the little coach will come out and kind of talk to you and kind of try to walk you through ways to go back to sleep. Somrest is a new thing that just came out. It's a 9-week course. And it, you know, anyways, they kind of tether you through sleep restriction therapy, which is a type of therapy to help get rid of insomnia. It's pretty good. The data looks really good. They've actually done studies on this one, so that's pretty useful. Calm was the 2017 app of the year. It's basically has a lot of interest, a lot of good recommendations for how to sleep better. And most of it is, anyways, when I first looked at it, it was celebrities reading bedtime stories, but anyway. And then the best CBT is probably sleep therapy with a therapist. Not all therapists do CBT specifically for insomnia, but most do. The ones we tend to use the most are findyourbase.com. They unfortunately don't take insurance, but they have like a group session where that is a little bit more feasible. And then Southeast Psych has a lot of decent insomnia, and they take insurances. And then this is another study. So this is a study on behavioral sleep interventions on pain and how it affects sleep. in sickle cell disease. And so again, you know, one of the things that was really identified is that pain really disturbs sleep and then not sleeping can amplify pain. And so they're trying to do behavioral and interventions. So again, that's the retraining the brain to sleep kind of thing to try to improve both the pain perception and the sleep quality. And so they're recruiting through this month, and that's at Johns Hopkins. So then hopefully we'll have some data soon. Next slide.
Can you see it now? Or is it still stuck?
Oh, there we go. Okay, gotcha. So just to talk a little bit about pharmacotherapy, because again, that's one of the most common ways to treat insomnia. So there are common side effects to all sleep medications. So they all can cause dizziness. They can all cause daytime grogginess, right? If you wake up too groggy, they all can be habituating. And so what we mean by that is that your brain can kind of get used to you taking something to go to sleep. And then, you know, whether it's an M&M or it's melatonin or it's Ambien, your brain wants that, you know, to occur to be able to sleep. They all technically can cause abnormal nighttime behaviors. However, there are certainly ones that are more likely to do that than others. They all can cause falls in some way. That's kind of same vein as dizziness. Pretty much all medicines can cause headaches, but yes, sleep aids too. And then certainly all sleep aids, they want to caution against driving and operating heavy machinery and that kind of thing. That being said, I certainly tell people that not sleeping also has side effects. So as much as we try to push not using pharmacotherapy, I do think that there are situations in which there is benefit to using pharmacotherapy to help people sleep better. You know, again, in sickle cell patients who have amplification of their pain related to not sleeping well, you know, certainly I think there's an argument to be made to weigh the risks and benefits of using medications. So anyways, you know, yes, there's this big push not to use it, but I think that it is appropriate for some patients. Okay. So yeah, so now we're going to talk about daytime sleepiness. This is like 2 slides. There's not very many. We're almost done, by the way. The bottom line is that there's one study that has looked at this in sickle cell patients. There's almost no data specifically related to sickle cell patients for this. So daytime sleepiness, which is the fancy medical term for that, is hypersomnia, excessive sleeping. It affects 4 to 6% of the population reports excessive sleepiness at least 3 days of the week, at least some point in their life. The primary central hypersomnia, so these are the brain-related hypersomnias, are really low. So narcolepsy, the rate of narcolepsy is 0.045%, so less than 1%, and idiopathic hypersomnia is 0.3%. So again, really, really low. Most people don't have those when they complain about daytime sleepiness. The vast majority of hypersomnia is usually a secondary disorder. So it's related to sleep restriction. It's related to an underlying sleep disorder. Mood disorders can cause it. Medications, and interestingly, hydroxyurea, its sleep side effect is it can cause sleepiness. Chronic medical conditions, again, I would count sickle cell anemia in there, and then circadian rhythm disorders, which is again where people's sleep-wake cycle is just not correct for their time when they need to be awake. And so one of the things I always like to point out is there's a difference between daytime sleepiness and fatigue. So daytime sleepiness is where people are actually falling asleep during times that are inconvenient or dangerous. They have trouble thinking clearly. They have this Epworth sleepiness scale. This is like a scale that we use in all sleep patients, but usually they're above 10. And again, there's some causes of that. And the fatigue is really low energy. So they want, people who are fatigued want to rest. They feel like they can't motivate themselves to do anything, but when they get the opportunity to rest, they don't actually fall asleep. So, certainly can be related to sickle cell anemia. But it's a long list. And so one of the things I always tell people is that fatigue is not really something that we treat in our clinic because it's so related to so many other things. But daytime sleepiness is certainly something we treat in our clinic. And so then this is a couple of slides about restless legs. And so, you know, these are some, those are some things that people complain about. Probably the most common thing that I hear is people complain about, they say they get a creepy crawly feeling, or one of my patients describes it as the budges. So, you know, it's not pain per se, it's like a discomfort. And it kind of, the way it works is it kind of ramps up, and then they move their legs, they get a little bit of relief, and then it ramps up again. And it just kind of does that over the course of the night. So RLS affects 2.5 to 15% of the population. It's more common in those with kidney dysfunction, neuropathy, antidepressant use, because it depletes the neurotransmitter that causes restless legs. The antidepressants do, and pregnancy is a very common cause of it. So again, the cardinal symptoms are an intense urge to move the legs, accompanied by creepy crawly sensations. It worsens with inactivity. It's partially relieved with movement, and it's almost exclusively seen at night, and it's almost exclusively in the legs. Again, one of the common things I hear is I put holes in my sheet. So, and so again, these are there's one study that looks at this, two published studies, I guess, that looked at it, but they're both small. So neither found any significant difference in daytime sleepiness in sickle cell, and then one found increased restless legs, and one found no difference in sickle cell patients versus the general population. Again, they were both small studies. They both had less than 50 patients that they looked at. And so, you know, I would say it'd be hard to make a definitive conclusion based on the data. And so again, that was it. Basically, it's just important. Sleep's one of the 3 pillars of daily health. Sleep apnea and insomnia, again, are the most common sleep disorders that are seen and studied in patients with sickle cell disease. And again, there's some studies that are coming out soon, which is great. And treating both can help quality of life and experience with sickle cell disease and decrease pain, apparently. That's it. Thank you.